Hi, my name is Kim Kazar, Director of Operations for TRICAM, and I am here to introduce to you today Catherine Barber. She's a senior researcher at the Harvard School of Public Health Injury Research Center. She has a career of work on violent death and suicide, and she is really a leader in this space and has changed my framework of thinking about the topic on which she is going to present. And so without further delay, I'd like to provide the airspace to Catherine Barber, who will present on counseling on access to lethal means, collaboration at the patient and community level. Thank you for joining us today.
Thanks a lot, Kim. I appreciate the opportunity. Okay, now I gotta do a screen share. All right, and always takes me a minute to remember. Okay, now I'm set. So I'm really happy to be here, and I also really want to thank Steve. And so I understand most of you are mental health clinicians or nurses looking at how to improve both your own practice and your clinic or hospital in general. And I know that a lot of the strategies you use for suicide prevention really focus on the why. Somebody wants to try to take their life, and that's as it should be. But we are beginning to understand and really know that how a person attempts suicide really plays a crucial role in whether they live or die. And 15 years ago, clinicians, suicide prevention groups weren't talking about guns, and gun groups weren't talking about suicide, even though gun owners die at higher rates than non-owners. And it's not because they're more likely to be suicidal or to be mentally ill, but they are more likely to die should they become suicidal, presumably because their attempts are more likely to kill them. So that's a modifiable risk factor. And yet clinicians and the suicide prevention movement were kind of frozen, thinking, oh, this is too political. And gun groups weren't talking about it because it just wasn't on their radar. And it's changing now. And so I want to go over ways that you can be part of that change. First, by going over why means matter. For some of you, that might be old hat. And you can zone out for a few minutes. And then talking about how to change the discourse on I'm resetting my timer so that I make sure don't go over time, to make sure that you're talking about guns in a comfortable way. And then I'll be going into lethal means counseling and how to bake it into your hospital or clinic system and how to work with gun owners in the community. So to start with why means matter, and it's easiest to do that with a case. So Robert's a 27-year-old with a drug problem, and he recently moved back in with his parents. His girlfriend had kicked him out. She wasn't having anything more to do with his drug problem, and he was getting kind of violent. When he stopped going to work, his parents contacted a mental health center and urged him to see a counselor. He refused because his problem was that his girlfriend broke up with him. He called her, hoping to get back together, and she wouldn't. And feeling desperate, he went to the gun cabinet. But the guns weren't there because the clinician at the mental health center his parents had called had said, hey, make sure you don't have guns right home available to him right now. And he was intent in that moment. He slashed his wrists. His mother found him, took him to the hospital, and he recovered. And when he got back home later that night, he was still miserable, but no longer acutely suicidal. So why does it matter? Why do means matter? The first kind of three big reasons. The biggest reason is because the acute phase of a suicidal crisis is often brief. It's often the case that you're not like for weeks and weeks and weeks and weeks, feeling acutely suicidal, like really ready to swallow the poison or pull the trigger. So people who were seen in a hospital following a suicide attempt were asked in one study, when did they first start thinking about that attempt? And so what percent do you think said within 10 minutes of attempting? Well, it was 48%. So if you're a clinician and you're seeing a client who's over in this part of the distribution, okay, you have an opportunity to ask about suicidal thoughts and to intervene. But if your patient is this sort, and they're there with you because you're a marriage counselor or you're a substance abuse counselor or something, you don't necessarily know when that escalation is going to happen. The second part of the reason that access to lethal means makes a difference is that the intrinsic lethality of a method is very, very different from one method to the next. Nobody's surprised to learn that if Robert had used a gun 9 times out of 10, he would be dead right now. What are the odds using sharp instruments or overdose? They both have about the same case lethality rate. This is when you combine emergency department data and death certificates. And it turns out 1 or 2% of intentional self-harm with a sharp instrument or overdose proves fatal. Now, some of those may be non-suicidal self-harm. Some of them might be not serious attempts. So let's take away half of them or even 3/4 of them. You still would only end up with an 8% fatality rate, which is very, very different. So that's part of why means matter. Some methods are just intrinsically more deadly. And guns in particular have this attribute that starting the attempt is the same as finishing the attempt. Almost no other suicide method has that characteristic. Other methods give you time for either your mind or your body to fight back, to say, wait a minute, I don't want to do this. Or in the case of the body, no, you're not doing this to me. And also often, intent governs method choice, but not entirely. Often because many attempts are not planned, easy availability has a lot to do with what method a person is choosing. But did we truly save Robert's life? Did his parents truly save his life by moving the guns out of the cabinet? In other words, what proportion of people who attempt suicide and survive eventually go on to die by suicide? Is he likely to hit another one of these spikes in 2 weeks or 5 months and find a method that will do the job for him? And it turns out about, when you follow, there are tons of studies on this, and when you follow people over time, about 10% go on to take their lives. So 90%, you've saved their life in the short term, you've saved their life in the long term. Even in one study that looked only at people who survived an attempt made by jumping in front of a train, even in that study, it was 10% who went on to die by suicide. So those are the 3 main reasons why means matter, and particularly why it makes a difference, putting time and distance between a suicidal person, and particularly a gun. Any method that's very easy to kill yourself, but particularly a gun, since guns are responsible for over half of suicides in the US. It's a lower proportion in Illinois, more like 38%. It's the leading method, but a lower proportion in Illinois because Illinois has lower gun ownership and also lower overall suicide rates than the US as a whole. So changing the discourse. So if guns are a risk factor for suicide, how do we reach gun owners at risk? Since it's a pretty simply modifiable risk factor. You know, it's not that hard to store your guns away from home until you're feeling better. So how do we reach gun owners? Do we do it with an anti-gun agenda by saying, oh, people shouldn't have guns or guns are bad or whatever? And I would say that's probably like sending an anti-gay group to do suicide prevention in the gay and lesbian community. If you don't trust the messenger, you don't trust the message, and you're likely to just kind of get the message wrong. And what is the message? Well, let's say a person, anybody is saying, I'm worried about my husband, that he might attempt suicide, or if they're saying about themselves, I don't think I can take this pain anymore. You want whoever they're talking to, whether it's a clinician, whether it's their neighbor, whether it's their shooting buddy, whether it's a hotline worker, you want it to occur to them to say, is there somewhere you can store your guns for now until things straighten out? And not, you know, obviously you also want it to occur to them to say, how can I help you? And you want to help get them into some kind of care or support. So how do you disseminate this message? Well, I think there's a couple of strategies. One is a clinical strategy where you're incorporating lethal means counseling, you're building it into the system for clinical encounters, but not just clinicians, also gatekeepers who see their people when they're at their worst, like in a rehab center, in a divorce attorney, a clergy member. And also a community strategy, so that anytime you're learning as a member of the gun owning community, anytime you're learning about firearm safety, when you're first starting out as a gun owner, or when you're like if you're reading a gun magazine, you want to be getting that message that suicide prevention is kind of a basic tenet of firearm safety. And I'll talk a little bit more about what that means a little later. But right now, so in terms of the clinical strategy, lethal means counseling, I can't go into a full lethal means counseling training right now, but where you can get it online for free is the Suicide Prevention Resource Center has CALM online, counseling on access to lethal means. And in that training, I'd helped to write that training. What we're after is people having comfortable conversations with patients, not a cross-examination, not a, oh, you got to screen them for firearm ownership in a mechanistic way. We go over the options for where you can store guns away from home, how you can make them inaccessible within the home through, you know, locking and having somebody else hold onto the keys, or disassembling the guns and having someone else hold onto the firing pin or the slide or something. We also go over the legal context for particular states, because every state has different sets of laws that may constrain who you could store your guns with. We especially emphasize going upstream, not waiting for disclosure of suicidal ideation. I'll talk more about that in a minute. And we emphasize role plays, kind of online role plays, for self-defense scenarios when people have their guns for self-defense. And so you kind of want to work with them around how to balance getting quick access to a gun for a self-defense situation, like for another family member in the household, while controlling access for the suicidal member of the household. So in talking with a client or a patient about firearms, how you raise the issue, I think can make a difference. Like if you're in a conversation with a client who's talking about being like really suffering and maybe having suicidal thoughts from time to time, if you then say, do you have guns at home? That might go fine. or it might kind of rock them back on their heels where they're thinking, wait a minute, where's this conversation going? Am I in danger of losing my guns? I think I'll just say no. Versus if you said, wow, I really hear that you're suffering. You know, what some gun owners do in your situation is they store their guns away from home until things improve. Have you considered something like that? If they don't have guns at home, they'll interrupt you to say, well, I don't have guns at home. But if they do, they're hearing what the option, you know, what types of things you're bringing up. They're hearing that you're bringing up things under their control. And so it may be a more comfortable way to start the conversation. In terms of going further upstream and not waiting for disclosure of suicidal ideation, let's say you have a patient at a trauma center. They've come in after a car crash. This is their second drunk driving arrest. They have a history of alcoholism, rocky marriage, rocky employment. When you ask about suicidal ideation, they say, no, my life really sucks. I want to get my life back. So you could stop there. Lots of suicide prevention trainings, unfortunately, say, okay, no suicidal ideation. You're scot-free, go to the next thing. But to me, that person is kind of screaming like a possible risk for suicidality coming up 2 weeks from now when his wife walks out. A year from now, when his employer finally says, you know what, you're fired. We've had it with all of this the work problems around the alcoholism. And think back to that interval between first thinking about suicide and actually attempting. That's where you worry about these folks. If you have lots of risk factors for suicide, you can't predict when ideation might come up. And since the transition from ideation to attempt can be really fast, we train in Calm to give people a little heads up that if they're really suffering and there's life crises kind of going on, especially if there's not like engagement in good behavioral health, to give them a little heads up to say, I'm glad to hear you haven't been thinking about suicide, and I'm here to help make sure that you're getting connected to the services you need and the support you need. I want to give you a heads up, though, that sometimes a crisis hits and people who are already struggling can suddenly have strong suicidal feelings. And often these go away in a matter of hours or days, but they can feel pretty overwhelming when they hit. And I just want to make sure if something like that were to happen to you, I want to make sure let's think through how you can make it through safely, that you know where to call for help, that you do call for help, and that you have the confidence that if it hits, you know you can make it through safely. And one step would be for now to store your guns away from home or somehow make it really hard for you to get to until you're feeling better. So that's just because we don't know who's going to attempt suicide. We do know who's at risk. And this is, you know, it's sort of like a flight attendant saying in the unlikely event of a water landing. So in terms of baking it into the system, if you go and get training, like lethal means counseling training, or one or two people from your clinic do, it's going to make a difference for your patients. It's not going to make much difference overall for your clinic. You want the whole clinic or the whole hospital to get on board. And one way to do that is is make sure that the whole institution is ready. So train up all of the staff with, you know, something like Calm Online, because it's free. That's always an option, or get some sort of in-person training from. There are lots of different people who do trainings like that around the country. Change your protocols as of a given date. Say, we're getting ready, we're doing this protocol change. Here are the types of patients we talk to about this. Here are the local storage options. Here are cheat sheets for clinicians, so you know what you're talking about. And change your information system to give people reminders to bring up these conversations and to give clinicians easy access to resources, not to drive clinicians crazy with rigid information systems that kind of make you go through all these bureaucratic steps. Not to do that, just to serve as quick, helpful reminders and rapid entry points to resources. You also want to have materials on hand to give to the patient, to distribute brochures that list local storage options, and that are available for family members. And finally, you want to do some community outreach so that not only are clinicians giving the message, but also so that patients can hear the message. If you've already heard this concept at a firearm training you were at, or at the spaghetti supper at the shooting club or whatever, it makes it easier for you to hear the message inside the clinician's office. And so these are just some examples of materials that we used in a intervention in Colorado. This was on one side of the sheet was information about offsite firearm storage, and when background checks are involved and when they're not involved. And on the other side of the sheet was a list of which gun shops locally offered storage, what the costs were. Some of them were free, whether local police would do it, how much it cost storing in a self-storage place or a pawn shop. We also had brochures for family members that gave information about supporting a suicidal family member, and also about securing firearms and medications or storing away from home. Then finally, the last topic is engaging gun owners as prevention partners. And when you think about people like firearm instructors and gun magazine writers, these are such good messengers. First of all, there's almost always a real strong culture around safety, really strong values around protecting the family, those around safe and responsible firearm use. And those values just really dovetail well with suicide prevention. And what I've found is when approached as part of the solution, rather than vilified as part of the problem, gun owner groups are really psyched about being asked to help. And they bring a lot to the table, including this kind of can-do, creative, let's get it done attitude, and a real ability to think outside the box, especially to think outside the screen and treat box. So if you're interested in taking on lethal means safety work at your institution, please don't just round up the usual advisors who don't like guns. Reach out to gun folks, people who like guns, to help them, so that they can help you write up your lethal means counseling protocols. They can advise you about local gun laws that your message needs to take it into account. Firearm instructors know the gun laws. They can help you draft the family handouts, make them sound warmer and more welcoming to different types of gun owners, get you on the agenda, get you a table, at local sportsman clubs, get you a table at the gun show. Together, you can kind of plan out for your hospital or your clinic's catchment area. You can plan out a strategy for, okay, how are we going to reach out to all of the shooting clubs, to all of the gun shops, and also have them come and do trainings for your clinicians on, or maybe take your clinicians to the shooting range just to get to know, for those of you who are unfamiliar with guns, to get a little more familiar with guns, get familiar with locking devices. Doing this kind of work, I think I'm going to skip the next couple of slides because I want to make sure to have time for questions. And I think this is something very achievable, like in Illinois by 2025, to make sure that throughout the state, clinicians and gatekeepers, it becomes second nature to mention firearm access when talking with somebody at risk for suicide. And that for the gun owning community, that everybody who's involved in creating classes or websites or brochures that address firearm safety incorporate suicide prevention as just a basic tenet of firearm safety. That is, if you have guns at home, to be alert to signs of suicide in loved ones and to keep the household guns from them, from those who are at risk until they've recovered. And I want to end by playing this 30-second PSA that really shows how creative. This was the main gun lobbyist in Utah. This was his idea. 30 seconds. It might not come off so well on Zoom, but let's see.
Last year I was at my lowest, going through some pretty serious depression. A couple of friends of mine stopped by the house and said they were worried about me. Said they'd feel a lot better if they could hold on to my firearms until things turned around. I think they saved my life.
If your loved ones are struggling, talk to them about temporarily storing their guns away from their home, because things do get better.
Okay, so that's it. That's my email address if you have questions beyond the 5 minutes we have now. And on the Means Matter, there's lots of resources for gun owner groups and for doing that kind of community work. And I'm happy to answer any questions or also to hear about any work like this that's going on in your state.
Thank you so much for your presentation. We do have a couple of questions that were submitted. One of the questions ties the previous presentation with your presentation. And the question is, have you worked with veterans organizations on access to means and police departments and other organizations like that? And how do those conversations get initiated?
Yeah, we worked with the VA to create lethal means counseling training for clinicians and for peer specialists. And so that was very successful. The peer specialists, veterans who've been through suicidal periods themselves and have recovered and are helping other veterans, they're awesome at this. And they're some of the best messengers. We've also, there are efforts, one great website, I'm gonna get it a little bit wrong. It's like Ask the Effing Question or Just Effing Ask. It's a website for veterans about access to lethal means, and their videos of veterans talking about their own experience, where in some cases, people who had PTSD and they would keep their guns under their pillows, and what it took to eventually realize, I'm feeling suicidal, this is not going to work, and what it took to, to ask like their father or something to hold on to the guns. So a lot of veterans are getting involved in the gun safety issue. And another approach that one veteran group was working on is, I forget what you call it, the sleeves you put over the grip of the gun that can have a message on it, where they put a picture of a loved one. So there've been lots of different approaches to interrupting. One guy, a Second Amendment Foundation guy, refers to it as cause the pause, anything to kind of interrupt that access to a gun.
Thank you so much. There are a couple additional questions that were submitted in the Q&A. If you would be willing to address those, we would be very grateful. And thank you for your presentation today.